My name is Amanda Stoffel, and I am a speech-language pathologist at Grace Village Retirement Community, and I'm also the therapy manager.
My name is Kaelyn Stoffel. I am currently a CNA, or a Certified Nurse's Assistant, at Grace Village Retirement Community.
I was 25 years old, and I was in my last semester of graduate school, and I was doing an externship for that at Parkview Hospital in Fort Wayne. So I was being supervised in my last semester.
I started out as a helping hands when I was 15 years old, and as a helping hands, you're really just kind of an uncertified nurse's assistant. I would make beds. I would pass water, restock a lot of supplies, and really just do whatever like the aides or the residents would need from me.
So I worked at Parkview Hospital in Fort Wayne, and it was one of the two largest hospitals for acute care. It was very fast-paced, very busy. We had pagers we had to wear, and you could be in one wing of the hospital and your pager goes off and you have to quickly go to the other side of the hospital or to the ER or to the ICU at a drop of a hat. It was very, very busy and I would say very stressful, but I did learn a lot.
Was pretty fast paced for me as a teenager. Um, it was kind of like a go, 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 like whatever the aides needed from you, you kind of just like dropped whatever you were doing and did that. It didn't really matter if I was like making a bed or passing waters or restocking things. If they needed my help, I would drop what I was doing and I would go help them. And it was pretty rigorous for someone who really didn't have a lot of experience in the field and like didn't really know what I was getting myself into.
I absolutely think that people judge based on age and competence in healthcare. With age comes experience. People going into a appointment with a doctor or a surgeon or anything in healthcare, you're wanting that professional to have a lot of experience to definitely feel safe, like your life could be in their hands and you want them to know what they're doing. So like I said, with experience, I mean, healthcare is changing all the time with new procedures, new medications, new research that comes out, and that changes things all the time. So you want to feel safe that your caregiver, provider knows what they're doing.
Definitely think that people associate competence with age in the healthcare environment. Um, it plays a lot into experience, and when you work in healthcare, the patients that you get and the residents that you get, they are putting their life in your hands basically. So it's obviously a very big deal, so it's really difficult for people to gain that trust with their providers and their nurses and everything like that. You're putting a lot of trust in that person that is taking care of you, so walking up to a resident and saying like, hi, I'm gonna take care of you today, they're going to be a little bit iffy if they're like, you look underqualified.
So right after that externship, I was hired there for a full-time position. There were, at the time, including me, 8 speech therapists. The turnover rate for therapists in acute care was approximately every 2 years. So the department was very young. I got hired the exact same time as another girl that we had went through college together, and we did our externship there together. We got hired together, and then a lot of the other staff were also in their 20s. Their oldest person was our boss, and she, I believe, was in her 30s at the time. So it was a very young staff.
I am younger than most of my coworkers. Since I started out when I was 15, I was very young when I first started, especially in the healthcare field. Usually, when you are working in healthcare, you are at least certified and you have gone to some sort of schooling or classes. And a lot of the people there are grown adults with kids and a family, maybe. So when I started working, I definitely was the youngest person there, and by a lot of the other women that I worked with were in at the youngest their late 20s. I worked with a lot of people that were in their 30s and 40s, even older. The nurses were definitely even older too.
For most of my adult life, people have told me that I look about 10 years younger than I am. So I often got sarcastic questions like, "Are you even old enough to do this job? Aren't you only like 15? How old are you anyway?" Things like that. And I would get that from patients, and I would get that from family members of patients. I often felt like nursing staff didn't take me seriously, things like that.
My patients would definitely question my credibility, especially after I got my CNA when I turned 16. I had a lot of questions of, um, how old are you again? Like, are you old enough to do this? Like, even like sometimes now with my new residents that don't really recognize me, especially since I've gone to school, I have a lot of residents that don't recognize me and don't know who I am, and they'll be like, "How old are you again?" Like asking me questions like that. Like I would be helping them go to the bathroom and they'd be like, "Are you old enough to do this?" And I'd be like, "Yes, ma'am, I have a certification." Yeah, I do have to tell them a lot of times that I am certified to do my job and that I am qualified. And I have worked at my job. This summer will be 3 years. So I am definitely qualified and I definitely have had a lot of experience in the area. But it's just kind of hard for some of them to comprehend because they just like don't really see a lot of younger girls getting into the field. So it's a little bit harder, especially when they don't see me a lot because I'm at school. They just don't really trust me.
This happened all the time. Like I mentioned, since people already thought I was younger than I was, and I was just starting in the workforce, so I was young, it happened constantly. Um, I feel like patients and often family members and other staff gave me looks like they didn't trust me. And like I mentioned before, they were always asking how old I was, so they didn't take the things I was saying very seriously at first.
It took a second for me to gain their trust, especially after getting my CNA. I was not 18 when I got my CNA, and there were a lot of things that I couldn't do because of that. There's a lot of things that you have to be 18 to do, like operate a machine and just like operate any of the lifts, like help with oxygen. There's a lot of things that you can't do as a minor in the field. So I would have to go to the other aides a lot and be like, "Hey, can you help me with this transfer? Hey, can you turn this on for me?" Just like a lot of things like that where I would have to go and get help, which made it a lot more difficult to do my job. And it got to the point where I would go up to the other four aides that were on the hall and I'd be like, "Hey, can you help me really quick? I just have to put blah, blah, blah in the toilet." And they would just be like, "No, sorry, I'm busy." And it would get to the point where people would not want to help me because they knew it would take longer with me because I was like newer, I was younger, and they were just like, "I have to do this first," like, or "This is more important." And it would just kind of like hurt my feelings a little bit because I'm like, yeah, I am younger, but I still like I'm in the same position you are. And like then it also hindered the care that we were doing for the resident, to the point where I'm like, this person has been sitting on the toilet for 3 extra minutes than they're supposed to be because you are refusing to help me do my job, which was very difficult. After I turned 18, it did get a lot better because I was able to do things myself. Um, and I would not get in trouble for it if I did it myself, which was very helpful. And by the time I had turned 18, I had gained the trust of my coworkers because I had worked with them for at least a year and a half by then, and they were like, okay, we can see that you're competent, we can see that you do your job. Many of them have stated to me that they thought I was going to quit right after I got my CNA because they just were like, especially since you were a teenager, we didn't think that you were going to stick it out. We thought that you wouldn't like want to do it, or you would be lazy. Like, they have told me that, and it took me a while to get a lot of the other women to trust me in the area, and the other aides and the other nurses even were just like, oh, we'll have this other aide do it instead because we think that she'll be better at it. And I'm like, okay.
Yes, all the time. I felt like I was always being looked at and questioned, and so that made me work harder to show that I did know what I was doing.
Like I said earlier, a lot of my residents would ask me how old I was, if I was qualified, ask me just a lot of questions like that, not really trusting that I would be able to take care of them. Or they would specifically ask for one of the other girls to help me, especially since I'm a smaller person too, just in size and stature, and I just have a younger face. I would go up to them and be like, hey, I'm your aides this morning, I'm gonna help you get ready for breakfast. They would just be like, I know Vanessa's on today, can you go get Vanessa for me? Like, can you have her help? But a lot of the times, like, I don't really need the help, and they're automatically assuming that I'm like going to need help with assists and other things like that when I really don't need it, but they will ask for it even before I attempt to do my job. They'll just be like, oh yeah, you're gonna need to get another aide.
Sometimes before they could say it, I started saying things like, I know I look young, I'm actually not as young as I look. I would tell them I do have a master's degree. I might give them examples of other cases that I had worked with that had similar issues so they could see that I had some experience.
Like I said before, I did have to gain the trust of my coworkers and my residents. And by doing so, I would just work really hard. I definitely would say I worked overtime when I was scheduled, not like crazy hours upon hours, but definitely I was there at least 30 minutes longer than the rest of my coworkers. Either because I was falling behind or I was doing a lot of extra work. Coming out of getting my cert, I definitely was very by the book. I had to do things this way, then I had to do this, then I had to do this. So a lot of the times I would be very by the book on purpose in front of the other girls, because I wanted them to see that I was competent, and I wanted to do everything the right way because I was competent.
Definitely affected it, and I would say it deteriorated my confidence. I felt like people were looking down on me, that I weren't not trusting me, didn't take me seriously, so it started affecting me, thinking that maybe I really don't know what I'm doing.
Definitely at first, it really hindered my confidence of just kind of feeling doubt of like, wow, maybe I really don't know what I'm doing. I really did not enjoy my job for like the first 2 months I had it just because I felt really stupid. And it's not even really anybody's fault. There was just a lot of things that I thought I knew that I didn't. I was just really overly confident. I really thought that I knew what I was doing, which obviously, like, I had a good idea, but I was just so overly confident because I had already worked in a nursing home for a year. I was like, yeah, I got this. Like, I'm not going to need any help, nothing. And then I went into it and I was like, oh, this is hard. And like, for the first month, nobody was willing to help me. Like, I remember one time one of the other, actually it was a Q. It was the Q man came up to me and was like, hey, blah, 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 needs to go to the bathroom. Go help him. And I was like, okay, yeah, I've never worked with him. Do you want to help me? And she was like, go get someone else. I was like, okay, yep, okay, yeah. I had to figure a lot of things out on my own, and it was pretty difficult, I would say. And so it did hinder my confidence of like, wow, maybe I'm not cut out to do this, or maybe maybe I am bad at this, and maybe I am dumb, and like maybe I am stupid and I can't do this. Every once in a while I still will lose my confidence when I am questioned, or like I'll do something wrong in front of an older aide and they'll be like, "Oh, hey, like you need to do it this way." Like sometimes I will fumble over things, but um it's a little bit more difficult for me because I'm not doing it so regularly. Like, especially when I come back for breaks, I have a lot of issues of like forgetting to do certain things or messing up on something just because I'm not used to it. And I kind of in like in a different mindset coming home from college versus like last year I worked there every day over the year. Um, so I got very in tune to everything at the nursing home, and I was very good at, I had a routine and I was really good at like just moving along with my job versus like coming back from college. I have to remember how to do everything, and I'll forget a lot of things, and I'll forget small things, or someone's bed won't get made until 2 p.m. and it will just like kind of like messes me up a little bit. And then like especially when someone points it out, I will lose my confidence of just like, "Hey, like Kaelyn, so and so's bed, it hasn't been made yet today," and it'll be like 1 p.m. and I'm like, "Oh crap, like now I look dumb." um that kind of thing, but it does not happen as nearly as much as it used to, I will say.
Yeah, I made sure that I was dressed professionally, that I was always following the dress code rules for the hospital. Um, I would do things like making sure I made eye contact with the, um, could be a doctor, could be a nurse, the family, the patient, and sometimes we'd have to do case conferences where we would talk about the progress the patient's making, what our recommendations for people going home, and I would prep what I was going to say ahead of time so that I felt more confident in what I was saying.
I would just kind of move on with my day. I mean, I've gotten used to it at this point, especially still being very young. I'm not even 19 yet, and I will still struggle with this sometimes, and where people will doubt me and they'll just be like, I'm not really sure if you're qualified to do this. And I kind of just like let it roll over. I mean, I've heard it so many times in the past 3 years that I'm just like, okay, whatever. I really don't care anymore. Like, I'm at the point in my life where I'm like, I don't really need to prove myself to you. I know that I have the credentials to do my job, and I don't need you to tell me that I don't. Um, in that kind of sense, like, obviously, it doesn't come off that way, especially with the residents. But if I have a coworker that questions me and they're like, "How old are you again?" I'm like, "Oh yeah, I'm 19. Like, I have my cert, and I've had it for 2 years." Like, I will fully just like say that, and I'll be like kind of just in the sense of like, okay, try me because I will win. But like more so with my residents, I'm like, "Oh yeah, I'm 19. I've had my cert for a few years." Like kind of just like making conversation, but also at the same time like, "Hey, I am qualified to do my job," because I can tell when people don't think that I'm qualified. Like I can tell when they're questioning me, and when they're questioning if I'm able to do my job or not. It's kind of more like second nature now.
I would say being reliable, being punctual, making sure I did my job the best of my ability, that over time then people developed the trust in me.
I definitely had some strategies that I used. And a lot of them I have already mentioned, where I would like casually mention that I was old enough and that I had a cert, and I would also like be really by the book in front of my older coworkers. Just like kind of things like that were really my strategies. Yeah, I also like tried to make conversation with my coworkers a lot, just like gain their trust, and um make sure they kind of like met me and knew my personality, just to kind of just like gain that extra relationship, so that they would trust me more while we were doing our job.
They do. So, in my current position, we have a high school senior that is an intern for the therapy department, and I asked her if she felt like she was being judged based on her age so far this year. She said definitely. She said many people either bypass me or talk over me since they're older they think they know more than I do and that their way is better. She said several people don't think she's capable enough to do her job, and that could have been staff or family. And she said often the patients will judge her, thinking that the way she does things is wrong. They get irritated with her, thinking that she's too young.
I would say time. Over time, I gained trust from my residents and my coworkers. I honestly don't think anything else could have done it. But yeah, sticking at my job and talking to them, making those relationships, getting comfortable with my residents, like everything like that is really what set me up to just succeed and gain their trust. I don't think anything other than time would have done that.
I think that they need to listen to them. They're freshly out of school. They've learned new things. Since healthcare is always changing, like I mentioned, they have fresh ideas. They're not stuck in a rut or the same routine of doing the same thing. So there's a lot that people that have been in healthcare can learn from the new upcoming employees.
I wish people would just um honestly, I mean, just trust us more. Saying like, hey, yeah, we deserve to be trusted, but I mean, it's true. Like a lot of us either came out of college or um just got our certs, or are really eager to be in the field because we're doing it at such a young age. Like we care a lot about what we're doing. You're not seeing that burnout from younger employees the way that you are with the older ones. Like you're not really seeing that burnout because they've been doing it for so long. You're going to see these youngest employees be more engaged, be more excited, be more they're going to achieve more things because they're so excited to get into this field. Like one of the reasons why I started so young in healthcare is because I knew I wanted to continue further in that area. So I was definitely, I would say, more ambitious in the field, and I wanted to do more, and I was excited to do more, and I was definitely an overachiever, and I was very aggressive when it came to getting things right and doing those things. Like we have, I don't want to say more drive, but we definitely are way more excited about being in the field, and we will get things done. I don't really think I've ever met a younger employee or any of my younger coworkers that was lazy. A lot of the times we are in these healthcare positions because we want to learn more and continue to move up in this area. So you're not really going to meet a younger coworker that is lazy or doesn't want to do their job. Like we're here for a reason because we want to learn and we want to do more and we want to experience more. And because we're fresh out of college or fresh out of classes or any of those things, we it's more at the front of our heads. Like we remember more about it. So a lot of the times you'll see, like, maybe you'll see them make mistakes, but it's more critical mistakes. So seeing these younger workers being more cautious and more careful about the decisions they make and how they do certain things is important because it can be a critical decision to make, or it can be a it could end up going bad based on how important this decision is or what this mistake may be. So having that more detail oriented employee is a lot more beneficial in the field, I would say.
So when I started, I was 25. You were 15, coming into healthcare at a nursing home now instead of acute care hospital. So the whole dynamic of the place is more slow paced. If it's supposed to be their home environment, so it's more keeping people comfortable and safe and not as much diagnosing things like at a hospital. So I feel like you didn't have as much pressure in that sense. It was shortly after COVID, so things after that had changed. So, still having to do more PPE with masks when people would get sick. That wasn't as common when I first started. We only had isolation for like TB and C. diff and MRSA infections when I first started, and that was rare. And so that changes into having to wear masks for every person, changing them for each room, kind of things. So that definitely was a difference. I think people still judge you a little bit based on your age, and but the nice thing is your job starting out was just more helping people, changing beds, getting them drinks, just talking to people. So it was a good ease into the healthcare setting. So one thing that my boss told me when I was at the hospital and she started noticing my confidence decreasing, reminded me that I am the expert. So that has stuck with me for the last 20 years. She wanted me to know that even if you're talking to a doctor or a surgeon or a specialist, which is intimidating, especially coming right out of college, that in your field you are the expert. They're coming to you because you know the answer and they don't. So not letting the older professionals, patients, families decrease your confidence because you do know what you're doing. You're the one that learned it. You have the degree.